Hi, Dr. Emma here from Medicine Within. It's been quite a while since I posted a video, so I thought it was time. A really important concept that's been coming up a lot that I like to make sure to tell people in my intro call with them is that you can't just take ketamine alone and expect to heal. In order to heal from ketamine, you have to do more than just take ketamine, which is counterintuitive to a lot of people because a lot of clinics, a lot of providers simply give ketamine and that's it. They just screen to make sure it's physically safe for you to take it. They give it to you, and then everybody crosses their fingers and hopes that it works in the ways that they want it to work, that it provides neuroplasticity and antidepressant and anti-anxiety effects that really help somebody. And sometimes that's enough to help people, but what can happen in that model of just giving ketamine and doing nothing else is that someone finds out that they are good as long as they keep taking ketamine. And nobody wants to just keep taking any medication. Some people get to the point where they're so desperate where they say, I don't care, I'll just keep taking it because it helps me feel so much better. But if you have to keep taking it, it's not actually getting to the root cause, and there's a big chance that you're missing something. You're missing a golden opportunity to dive deeper. So half of what ketamine does is really help with neuroplasticity, impacting certain receptors in the brain that are a novel mechanism compared to classic antidepressants. And the journey itself with ketamine, the experience of taking it, is also diving into your subconscious and like looking in a big old mirror and seeing things about yourself, about your relationships, about your circumstances, about your past, about your traumas from a loving, heart-centered place, from a place where those things are easier to look at and you have more of a compassionate, loving, kind angle on them, which in and of itself can be really healing. But then you got to do something with what comes up, right? And yes, definitely you can go rehash it with your counselor or therapist. It's important. But sometimes a lot of counselors and therapists don't exactly know how to translate the way things come up in the ketamine space if they don't have experience with it themselves. Because a lot of the things that come up can be really abstract, or they can come up in a very symbolic way. And sometimes patients intuitively know, oh, this is what that means. And then other times they come out of it and are like, what the heck was that experience? I am confused. So all of this to say, again, in order to heal from ketamine, you can't just take ketamine. You have to do more. You have to do integration. Like if you're really going to squeeze the most out of it, you got to do integration. And because it takes a lot of time to get somebody properly prepared and screened and ready to take ketamine, then it means that you're spending a lot of time with a provider. So it's an investment. It's an investment in your health. And that's why I'm not everybody's first stop. They've often done all the things. They've tried a lot of different medications. They've been in therapy for a long time. They tried many different ways of doing therapy. And they just haven't gotten the relief that they really want. So they want to try something new, something novel. And ketamine is novel, but it's not simply an antidepressant or an anti-anxiety medication. It's so much more. It is an experience, a journey, a dive inward. And again, if you want to get the most out of it, you have to integrate. You have to talk with somebody who's really familiar with that space and knows how to help you translate what comes up for you and then weave that into your life in an actionable way so that it's not simply this aha moment that then disappears and doesn't become anything important in your life. This is true for any psychedelic medicine. And it's definitely true for ketamine. It's no different, as it is a psychedelic-like experience. So thank you so much for listening if you got all the way through this video. And let me know what else you want to hear about.